So warm welcome to all of the viewers from various parts of the world who must have joined us by now. From here on we are going to start our conversation. Rather than conversation, we are blessed to have so many questions pouring in from various parts of the globe, and we'll continue taking those questions because the most important thing is, rather than any topic to be discussed, the most important is the questions. So I'll be starting with those questions which I postponed for the English session. Gauravji, you can now ask those questions.
Mr. Gon Chase 3030809 is taking kidney care oil and Mukta Pishti. He's fine, but sometimes in cold his BP increases. So what he can do?
Mr. Gon, basically the kidney care oil and Mukta Pishti that you are taking, basically they in itself are for controlling blood pressure also. So in case you feel that the blood pressure increases at time, the medicine which you can add over here is cardio support. Cardio support contains a blend of herbs which is for controlling the blood pressure. So you can take cardio support along with the rest of the medicines that you are taking. And one thing which I believe you are doing and which you should have added by now is Sitli Pranayam. I'll do it for you over here like this. As simple as this. This is Sitli Pranayam. I'm not guiding for the technicalities over here of the Sitli Pranayam because the same are guided on our channel Risht Pusht by Vikram Yogi ji regularly, where the performer is Sana Sharma and Vikram Yogi is the basically guider who is the yoga expert who takes your questions and everything. So this Sitli Karam is very good for all of the kidney patients, especially those where the BP is increasing and the protein leakage is more. So do go for this Sitli Karam regularly. And the third thing, do cut off your salt. Your salt input should not be much. So take care on how much salt you are taking in your diet. Yes, Mr. Gaur.
Mr. Babu Raviteja, treatment for infertility for nil sperm counts, FSH and LSH increased.
Mr. Babu, basically, if the FSH and LH are more, when we talk about azoospermia, they can be of various types. It can be obstructive azoospermia, it can be non-obstructive azoospermia, it can be maturation arrest azoospermia, it can be testicular failure, it can be Sertoli cell only syndrome. So the FSH LH levels which are more, we need to see how much more. What exactly is the increased level of that FSH and LH? That is something which is really very important for us to know. So Mr. Gaurav Kataria, who is here online with us, please leave your number for him. Immediately after this live of mine, he shall be connecting to you and he shall be taking some further details from you, certain reports, certain things, and then our expert panel will discuss everything. Finally, they will discuss it with me and we'll be connecting to you. There are a lot many things that can be done in Ayurveda, but we need to be very much knowledgeable about the underlying disease. So let us go through the disease, and then definitely Ayurveda is having a lot of scope for a patient like you. Yes.
So Mr. Partha Sarthi, a Bangalore OPD patient, he is having less pumping efficiency, going to Madurai hospital to take up with the cardiologist and nephrologist.
Mr.
Partha Sarthi, the Bangalore OPD patient.
Mr. Partha, can you please update us with the echocardiography that you have gone for? You can update it on our app, through our app. Otherwise, Dr. Kapil will connect to you after this live of mine. You can share that with him also. We will check whether the ejaculation fraction is a bit lower or too much of lower. And the medicine which you are taking from us, please add cardiac care syrup. There is a syrup for improving the working of heart, which we generally guide to our kidney patients. And the reason why we have to guide that is because due to the fluid overburden in the body, when a person is a kidney patient, due to the fluid overburden in the body, at times there is left ventricular hypertrophy also in the patient. The ejaculation fraction of a patient may decrease. So cardiac care syrup is to be added at that stage. So that is something which you can add, and definitely you are doing right. You should consult a cardiologist also, and whatever he guides you, you can update it to us also. And in any case, see, it's my genuine advice. Generally, at least 70 to 80% of our allopathic doctors know about the Ayurveda, which was that ancient Ayurveda of those powders, karas and everything. They are not in a favor of taking Ayurveda. So until and unless very much necessary, avoid telling him that you are taking some Ayurvedic medicines. Let him add what he wants to add, but avoid telling him that yeah, you are on a Ayurvedic medicine. Yes.
So Mr. Chauhan Sunil, he's a kidney patient and he's under dialysis thrice a week, and fistula is also installed on 31st December. But after dialysis, he is unable to walk and used wheelchair. Even before dialysis, he used to walk 4 to 5 kilometers daily. Please give suggestions.
Mr. Chauhan, it's very disappointing to know and very bad to hear also that it was absolutely all right before dialysis, and now after 3 dialysis per week the condition is so worsened up. Generally it does not happen with dialysis, to be honest, although I'm not in favor of dialysis, but in majority of the patient condition does not worsen that much. In any case, if you are passing urine, see our parameter, the thing which is important for us over here is that whether you are passing some urine or not passing any amount of urine. Please reply back with whether you are passing urine or not. And if you are passing urine, definitely there is hope in Ayurveda. But we shall require complete case study in your case. If you are asking this question on YouTube, please help us out with your phone number. If you are asking this question on any other platform, please switch from that platform to our channel, Dr. Navdeep Sharma on YouTube, and leave your number over there, because the privacy of other platforms, your number may go to many other places and you will start getting so many calls. So prefer leaving your number on our YouTube channel, Dr. Navdeep Sharma, and my team will immediately be connecting to you after this live of mine, and we'll make sure whatever best we can do in Ayurveda for you, we'll try to do that. Yes.
Mr. Avat Kishore Das, 341335, existing patient, sir. His protein leakage has +2, and he's 24 hours urinary protein is 766, and he has a pain in back and urine.
Mr. Avat Kumar ji, please also help me out with this thing, that whether this is the first report that you have went for, or are we having a previous report also and now this is the final report after that, so that we can compare. So please help me out whether this is the first report or it is a report after a particular phase of treatment, and then I'll be connecting and comparing the things and I'll be guiding you on this. Please reply back with this thing. Yes.
Mr. Prasanjit Paul, sir, patient ID is 327506. Is recently 24 hours urinary creatinine is 0.81 and serum creatinine is 2.40. And last my serum creatinine was 1.94. Getting chest pain and back pain.
Mr. Prasanjit Palji, I remember your case, I remember your name. You are a regular patient with us. And it has been really cold winter this time, and due to this cold winter there are parameters of some patients which are disturbed. So in your case, I remember your case and I would really like to go through the full details. Also go for a urine complete test to see if there are any pus cells or any kind of urinary infections during this season, and due to that it is rising. Otherwise also immediately after this live of mine, I'll make sure Dr. Kapil connects to you on this. In your case, we can take not a single chance. So your case is very important for us. Thanks for connecting to me also. My team, Dr. Kapil, will immediately, Dr. Kapil, do make sure that you discuss the thing with me and then get back to Prasanjit ji. So Prasanjit ji, Dr. Kapil will be connecting to you shortly on this. Yes.
Mr. Ashwini Rastogi, he's asking about the metastasis carcinoma cancer treatment.
Mr. Ashwini Rastogi ji, if we are talking about a metastatic carcinoma, what is important over here is that where exactly is the metastasis present. See, generally when a patient comes to know about carcinomas, majority of the carcinomas are metastatic. But what is important is where exactly are the metastases, what is the report as per PET scan or MRI scan. That is something which is really very important. See, we need to know which organ is involved and to what an extent that organ is involved. Because if we know the extent to which an organ is involved, we know that whether there are Ayurvedic medicines which are really going to work in that particular organ. So please help us out with your MRI or a PET scan report. Let our team analyze the things. You can leave your number for our team to see, to discuss with you and get back to you. Definitely there are cases where Ayurveda has shown very good recovery in such cases. Yeah.
Mr. SK is asking about his SL care is for reducing viral load, and please suggest any anti-care medicines for pain, twisted, heaviness, tingling of my both legs.
Mr. SK, if you want to add a particular medicine, one of the medicines, which shall be available in the market over there. See, it does not matter whether the medicine is from ND Care or from any other good company. What is important is that it should be able to help you out. So if Balarishtam is available nearby you, you can start with Balarishtam 20 ml in the morning, 20 ml in the evening. If Balarishtam is not available and you want to go for medicine of ND Care, the name of the medicine is Remocare. Remocare, 1 capsule in the morning, 1 capsule in the evening. You can take with lukewarm water. Along with that, you can take sesame oil. Sesame oil, and you can fry some turmeric in it. Now, use that sesame oil for massaging. So, start with Remocare, 1 capsule in the morning, 1 in the evening. Balarishtam 20 ml in the morning, 20 ml in the evening with warm water, and sesame oil to be massaged. You will get good recovery with that. Yes.
So Sumit is thanking us, sir. His creatinine level goes from 7.8 to 3.2, and he's taking the Panchkarma therapies from us.
That's really good and encouraging, and really kind of you to share the things. So it gives a lot of encouragement to many of our patients when reports pour in where patients are improving. Yes.
So Nayan Chakrabarti is asking that 319191. My mom is a kidney patient. She's suffering from too much body pain. So my question is how to overcome from this excess pain.
Mr. Chakrabarti, can you please further share the current level of creatinine, urea and other things? See, when we are talking about pains in a kidney patient with other parameters that are increasing, at times what increases is uric acid. Now that uric acid is a cause of excessive pain. Another thing which is evident in the kidney patient is that in a kidney patient the calcium depletes very quickly. So again, that can be a cause of pain. So we need to know the cause of pain. There is one thing which can help right at your place for your mom, and that is taking a massage of sesame oil and taking a sun bath, sitting in the sun. That is really going to help her. Along with that, if you can spare out some time for her, Panchakarma. In a patient where Panchakarma is possible, when the patient is not going for regular frequent dialysis, the patient is in a position to travel. A kidney patient should not ignore Panchakarma. It is something which really helps out a lot to patients. Yes.
So our patient Sri Lataji 325828 polycystic kidney disease. She's asking that whether we have to take the medicines after 25 minutes post meal or 30 minutes. It takes 10 to 15 minutes for taking 10 tablets and a lot of bloating issue. Is this causing?
Lataji, please do not count the number of tablets. We definitely can reduce the number of tablets. I always guide my patients that when the number of tablets are more, do remember that Ayurveda, if we go to the back Ayurveda, there were more of kadas, more of churans, to condense those churans and everything, and to maintain the efficacy of herbs, the number of tablets are generally more than the allopathic tablets. And since you have raised the number of tablets, Dr. Kapil shall connect to you. He will then discuss the case with me, and we'll also try if we can reduce some tablets out of those. What I personally feel, if you go to your parent question, that how much time is required, the gap which is required over here is a minimum of 30 minutes. The greater the gap than 30 minutes, say if you take it after 40 minutes, after 50 minutes, it's more better. So take more of gap, not less of gap. Because what happens is, if the food is still in your stomach, when the medicine goes, the food, it basically inhibits, it reduces the absorption of that medicine, the metabolism of that medicine. So that is why we generally advise that much gap with food for a particular medicine. Yes.
Mr. Rahul Agarwal's father is diagnosed with squamous cell carcinoma. Can he be healed through Ayurveda?
Mr. Rahul Agarwal, really sorry to hear that he is diagnosed with squamous cell carcinoma, but do not worry. What is important over here is that what exactly is the PET scan or the MRI scan saying, and what is his physical health condition. These two things are really very important. If these two things are in favor of him, he definitely can have and expect a good recovery with Ayurveda. So simply by saying that squamous cell carcinoma, what exactly are the chances of recovery, it will be a wrong commitment that I'll do. I don't want to do a wrong kind of commitment. So what I want over here is the reports, the details, and then my team of doctors. Dr. Kapil, note down the name, any name which I am telling, everyone should get a call from you and make sure Mr. Rahul, you can leave your phone number over here. Dr. Kapil shall be connecting to you. He shall be going through your reports, going through the details. You can expect a call back between 9:30 to 10:30 today after my live. So then we shall analyze the things, we shall discuss the things, and then we shall be getting back to you on that.